Hi, I'm Scott Miller. Welcome to my Top Performance blog. It's Labor Day weekend, the last long weekend of summer. And 1 year ago, from this exact location here in Southwest Michigan, I announced the formation and launching of the International Center for Clinical Excellence, the ICCE. Since that time, hundreds and hundreds of clinicians and researchers and policymakers from all over the world have joined the ICCE, making it the largest online community of professionals dedicated to improving the quality and the outcome of behavioral health services worldwide. As director and founder of the ICCE, I had an ambitious goal. I wanted it to become the online resource for professionals trying to achieve their personal best. How were we going to do that? By providing a place for clinicians to connect 24 hours a day, 7 days a week, 365 days a year, with an emphasis on getting the help they needed to achieve their personal best at any time. Providing a place for policymakers, researchers, and clinicians to share their expertise. We knew from our travels around the world that there were many experts in the community whose voice was never heard, and providing a place to learn from highly specialized discussion groups on the ICCE, a wide range of documents that are constantly being uploaded and changed in the online resource library, and videos uploaded by the world's top-performing clinicians. This last year, together with the certified trainers and senior associates of the ICCE, we've put together the only recognized curriculum for training clinicians in feedback-informed, client-directed clinical work. The curriculum we've developed together with manuals and trainers is recognized worldwide and being used in agencies all around the globe to implement outcome-informed clinical work. As part of our commitment to training therapists to adjust to the new world order of clinical practice, each year we run 2 highly specialized trainings. The first is our advanced training held every year in February in Chicago, Illinois. That particular training is designed to help clinicians learn the basics, the foundation of feedback-informed clinical work. In August, we run our annual Training of Trainers event. 4 intensive days designed to prepare agency directors, supervisors, etc., to train their staff in the principles and practices of outcome-informed clinical work. By the way, here are a few snippets from people who attended this year's TOT.
Hi, I'm Cordelia Miller Muhammad, and I work for the Counseling Center of Lakeview as a clinical project director for one of the programs that we were funded through SAMHSA to serve homeless adolescents. The mission of our agency is that we actually try to serve the marginalized population. And I saw where this particular style of service delivery would give them power, empower them, and give them a voice. But also, I am in the state of Illinois, and we're broke right now. And so community mental health agencies like mine are suffering. We're a small community mental health agency that's strong with values and is the love for people or those who are struggling, who do not have resources. And we want to stay alive. We want to be able to continue to provide services. I believe that if we can incorporate this approach into the way that we service our population, we will continue with our legacy, and we will continue to be able to make a difference in the lives of those who have mental health challenges.
I'm actually a mental health and drug and alcohol administrator. I work for a county board in Ohio, and we have 2 counties that we oversee the public behavioral health care system.
Great.
And we're looking to have all our agencies that do clinical treatment to use the CER.
I'm Dr. Richard Hooker. Just returned from being overseas and working with military adolescents and families for the past 8 years, where we implemented the client-directed outcome-informed approach.
Pretty much all over Western Europe, isn't that right?
You're truly,
Yes.
at this year's Training of Trainers event, you're one of the more experienced folks here using the measures, etc. Is there a takeaway from this experience over these 5 days, given your very broad and deep and long experience with CDOI?
Yeah, I think it's like how do you switch gears, change hats, change roles from being in a place where you're doing it, you're seeing clients, you're doing clinical supervision, to moving into that different role of how would I articulate this, what other tools would I use as a trainer as opposed to a clinical supervisor or a clinician.
We have big plans for the year ahead. Soon we'll be announcing the formation of the Behavioral Healthcare Policy and Research Institute. Briefly, we've invited, and many researchers and policymakers have accepted, an invitation to participate in a forum for making policy and reimbursement recommendations based on a solid review of the empirical evidence rather than on ideology or special interests. But that's not all. Of course, we have many other events coming up. Number one is our Achieving Clinical Excellence Conference to be held in Kansas City, October 20th through the 22nd. Secondly, we are working to increase the number of members in the online community of ICCE. If you're not a member, you can join today. It's completely free. Go to www.centerforclinicalexcellence.com. And of course, as always, soon we'll have the advanced training in February in Chicago, and also the TOT. Remember, in both of those trainings, space is limited to I don't have to tell you that we clinicians and behavioral health professionals are working in difficult and challenging times. However, if you've been watching my blog, you've heard of agencies and practitioners who are not only surviving but thriving by learning how to track and improve their outcomes using client feedback. For those of you who are already members, let me just offer my personal thanks for contributing to what has been a very successful year for the International Center for Clinical Excellence.